Welcome. This is the Aurora Health Alliance Senior Circle. Hopefully you're in the right place. You didn't zoom into the wrong meeting. We have 3 presentations today. JoAnne, Hirsch, Shirley, Proppe, and Debbi MacLeod.
So I know this will look like a long presentation. There's a lot of slides, but Joe has all of the slides, and I'm going to probably skip over some just because I don't want to take too much time, because I could go on for like an hour at least. So that's who I am. I'm with the Colorado Commission for the Deaf, Hard of Hearing, and DeafBlind. I'm the Communications Technology Program Manager, and kind of go into what that means, what this program entails. But basically, the commission as a whole covers any topic related to deaf, hard of hearing, and deafblind. Deafblind means low vision, hard of hearing, low vision blind, fully deaf. There's a whole gamut there. Same with deaf and hard of hearing. So go to the next slide. So this program specifically provides or focuses on communications technology, like telecommunications, meaning that means communication over phone or internet line. So making a call, texting, emailing, surfing the internet, those are all telecommunications functions. And some of the examples I'll show you that we provide in the program are amplified phones, captioned phones, mobile wireless devices like smartphones and tablets, signalers and amplified devices. And then we have a specialized program for deafblind that I'll touch on at the very end. Next slide. So the goal, just like all of you guys, is to promote independence. A lot of times our consumers, as they lose their hearing or vision, they become more isolated. They've depended on other people to pick up the phone for them. Actually, I get that on a daily basis, a spouse, and maybe that spouse has passed away, or even the spouse or their partner is just gone shopping and now they're home alone and they won't pick up the phone because they can't hear it. So we want to make sure we provide them with the right tool, so they have access and they can be independent and not have to be dependent on somebody else, but also be involved and engaged in the community. Next slide. So we do have certain qualifications, and so I mentioned deaf, hard of hearing, deafblind obviously is a qualification. So if you kind of tick off that, you would just have somebody certify that hearing status or deafblind certification, acuity, and that's all on the application. So possibly service professionals like yourself who, like Shirley, I would probably be comfortable with Shirley signing off on a form because she works specifically with the low vision community and is familiar with our program, and works with us many times directly for our deaf and hard of hearing community. You have to be a resident of Colorado. We don't ask for proof of it anymore, but just that you have a local address. If needed, I could verify it somehow. And then lastly, to meet the income guideline, which is 400% of the federal poverty guideline. I think there's a slide in it showing what that looks like, but it's also on the application. Just to give you an idea, it's about, for a one-person household, if you earn at or below $51,520 a year, you would qualify. And then it goes up from there depending on the number of people in the household. So it's pretty generous. It's not the FPG, it's actually 400% of that. So next slide. Okay, we can skip over that because I just went over that. Okay, and I already mentioned some examples of who can certify: a service professional, a medical professional, audiologist, pathologist, or people like yourselves who represent public and private entities. Next slide. So I'm going to skip over this just because I'd rather show you pictures. So next slide. We do have demonstration centers throughout the state. Most of them are at independent living centers, and unfortunately with COVID, most of them are closed. They are starting to do by appointment only, or they are starting to go into people's homes and actually do a live assessment if needed. We would prefer a person have an assessment because then we know that device is going to work best for that person, and then they're not going to give up. So if happens a lot, if a wrong device is given out, they're not going to use it, and then they don't want to try something else. So I also do assessments either in person or over Google Meet currently, and I can show them devices. And just these are some of the questions that are really important. You wouldn't think, like, how is mobility an issue, or primary language, or who they're speaking to. These all take into consideration when we're matching them up with an appropriate device. So I'm sure you guys do intakes and assessments of your own consumers, and some of these might be similar, but this just focuses on the telecommunications side. Next slide. So amplified phones, these are a description of what they include, but I'm going to go to the next slide so you can actually see what they look like. So here's an example of some amplified phones, and you would say, wow, that looks like something I already have at home. They are. They actually are standard. They look and feel like standard off-the-shelf phones, but they have amplification up to 50 decibels or 55 on some. A standard off-the-shelf phone is about 15 decibels. And for every 1 decibel, it's 10 times stronger. Once you get past that 50 decibel mark, because there are some phones that can go past that, it becomes distorted, not really clear to the person. So just because something's louder, it doesn't mean that a person understands it. So not only do they amplify the speech, they also adjust the tone of a person's voice. So I think we may have one male on this webinar, on this presentation, but male and female voices, you got your higher pitch and your lower pitch. A lot of people hear one range versus another range. Maybe they can adjust their hearing aids to hear better on different ranges, but these phones also adjust tone of people's voices. So I could be talking to somebody and I can make their voice sound lower so I could hear it better, or higher, depending on what my needs are. This particular phone also addresses mobility because it's cordless. It has slow talk, so it slows down live speech. A lot of people complain that people talk too fast, and I could be one of them. And so you could slow down the speech just a little bit. It also has a built-in answer machine that slows down the speech even more so for the messages, as well as amplification. So we try to address everything, and also including vision. They have talkback features. They have features where you just lift up the handset and it automatically opens the line. So it's good for low vision as well. Next slide. Just another type of cordless amplified phones. They also address this very similar. Sometimes it's just like hearing aids. I like the sound of Clarity versus Panasonic. I like these buttons on the Clarity better because I can see or feel them better. They just have different features. The one on the far left is a very simple one. So a lot of our seniors who don't like much complication really like that Clarity XLC2, which is on the far left, just because it's very simple, not too much features to get overwhelmed with, but a lot of them address the same functionality. The one on the far right, also and same with one of the Panasonics, you can actually pair with your cell phone. So people don't even have to have landline service anymore. They could just have their cell phone, but have a home-based amplified phone to get the benefit of amplification that their cell phone is not providing, because cell phones actually do not provide good amplification. It's things that you attach to it or connect to it that will make the sound more amplified or sound clearer. Next slide. We also, just a quick thing, we also offer corded. So if people just have a one-room home, they sit by their kitchen table, that's how they make their calls. These are a good option, so they don't have to lose the handset. Again, very easy to use, functionality, has similar features. These just don't have slow talk in them. And also they don't have a built-in answer machine. Next slide. This one's good for a low vision community. I think Shirley has provided it, or her program has also provided it in their programs. Large tactile buttons, easy to use slider, volume control. Again, not too many features. So because we don't provide training in this program, though we do have demonstration centers who are willing to go out and train them. And our vendors also can do that over the phone. We don't do as intense training. So sometimes the simple phone is better, so it's not overly complicated. Next slide. Again, I talked before about the Bluetooth. These are all the Bluetooth phones we offer. different options. Some have answer machine, some don't have answer machine. It just kind of depends on what their needs are. So again, that's why that assessment helps, so we can match them up with the best device for them. You can also connect these to a landline, so you can actually have your cell phone paired and have it linked to your home phone. So you've got two lines coming into one phone, which I find nice because a lot of times people are losing their cell phone in their home, and at least then they have, while they're in their home, they could always still access communication. Next slide. This is our brand new phone actually in the program. It's a captioned phone, but it's also an amplified phone. So it's that clarity phone, but it's connected to a tablet that we provide, and it's hard connected to the phone. So it's using the live speech on both sides of the conversation, and it has to be connected to the internet because it's looking in the cloud to match up sound with voice recognition software. But it's nice. It gives the freedom of using an amplified phone. Maybe some conversations, they don't need captions. They can walk around with the phone with amplification. And maybe if they're talking to the doctor's office, but they need to really focus on what's being said and make sure they get the right information, they can connect it with the caption and have that as part of the package. Again, this does not use the FCC's funding because it's using automatic speech recognition, and it's very accurate. So if you ever like participated in a Google Meet meeting and you use the captions for that, that's very similar. It's just using automatic speech recognition, but it's hard connected. It's not using any sort of environmental sounds, that are disturbing it. It's, as you could see, the wire between the phone and the tablet. So it's genuine speech it's using. Next slide. So the caption phones you guys might already be familiar with. Again, they are just encoded. They do have FCC guidelines and requirements behind it. There are different models. There are, landline only, phone and internet. Some have, the one on the left, it has speakerphone capability. The one on the left also has Bluetooth capability, but not to connect a person's hearing aid. Just remember, that's not the case. It's connecting like a neck loop or other devices wirelessly via Bluetooth, but not a person's hearing aid. This one does go through a relay operator. So a person is listening to the conversation, repeating what's being said into software, and that is what's generating the caption. So the difference between the one before I just showed you and this one, this might have a little delay. Again, there's a live operator behind the scenes, and it may have, again, because you're dependent on the relay operator in regards to speech, it may not be perfect. But again, they're great. They've been used for years. They're actually the founders of captioned phones. And many, I would say about 20% of our deaf and hard of hearing population choose a captioned phone based on their needs. Next slide. I'm not going to go over, these are just the rules and regs of a captioned phone. You'll have this later. You can always review it, but I don't expect you to know this information. So, but it's good, it's required for the consumer to know, not necessarily for you, but for the consumer. Next slide. So these are the notification systems. You can actually just order these as a standalone as well if you like. So ring notifications, you don't hear your phone ringing. We've got loud ringers, light flashers. We actually have a whole new, the bottom right is our home aware system where you can connect your smartphone, your home phone. It has a movable mobile light flasher, which is on the very far right bottom. That round egg part actually comes off its cradle and you can move it to different rooms. It has a bed shaker. That little egg thing in the front below the cell phone is the smartphone signaler. So again, you can connect your whole household to this. There's some other items you can add extra that we don't provide, but I like to let people know, which is a doorbell signaler and a smoke detector. So all of this can be in one package. A person can purchase like the doorbell and the smoke detector. They're about $50 to $60. And all the smoke detector is doing, it's actually not a smoke detector. It's just a sound collector. So it gets attached next to your smoke detector, and you just have to do it next to one of them. And then the sound will travel to this main home aware system. If it went off, it will say fire, your bed shaker will go off, your light flasher will go off in the red color, so it's color specific. So the doorbell, I believe, is like blue, and then again, that message goes across the main system. And that main system also is an alarm clock, so it can be used also waking you up with the bed shaker with the alarm clock. I think that's becoming most popular one because it addresses all a person's needs when it comes to communication notification. Next slide. Then we have our personal listening devices. So remember I told you how smartphones are not really great at amplifying. Sometimes people like their existing home phone. They just want to be able to hear a bit better. These are different devices the person can add to their current setup or order a phone with this setup. So we've got the headset and inline amplifier that can connect to a person's cell phone. It can connect to a person's existing phone. We provide them with a headset and hands-free mic, and that intermediary inline amplifier gets connected in between. The neck loop, which is the next one down, is that's what pairs to a person's hearing aids, and it can connect to their tablet, to their Android, to their iPhone, because hearing aids typically only connect to one type of smartphone device. Most of them, they're getting better. Some of them are getting both of them, but it's either Android or Apple. And so this can work with any of the smartphone or tablet devices. They just have to have T-coil in their hearing aids, which is a whole other topic, but it's just something for a person to know to ask their audiologist about. The last one is actually just an external cell phone amplifier. So they connect it via Bluetooth and they can put their cell phone down somewhere else, have the amplifier with them, and it gives them up to 50 decibels of amplification for their cell phone. So they don't have to hold both, just be within a certain feet and then have that great amplification. Next slide. So these are all the wireless devices we offer: Apple, Android, so iPhone 11, iPads, iPad mini, Google Pixel 4a, Samsung S10, Android, I think it's the 4 or 5e tablet, and then we still offer the Jitterbug and the Jitterbug Smart for people who want a more simplified phone. Next slide. We also provide all built-in applications on our smart devices. So we have all our video phone applications for our deaf signing community. We offer the Captioned Phone apps already pre-installed. We have language apps for people who want to learn sign language. Live Transcribe is for Android. It's a great application if you have an Android device for captioning. It captions on the phone. It can also caption one-on-one communication, and those are built in. That one's by Google. And then there is specialized amplification apps. A lot of them are specific to Androids, though. Apple is a little bit behind when it comes to our hard of hearing community. Next slide. So these are, again, specific Android apps just to be aware of. I would definitely keep note of these. They could benefit you. They could benefit your community. I personally think they're fabulous. As I said, Android with Google is kind of light years ahead right now compared to Apple when it comes to these types of applications. Next slide. So we provide warranty. So for our home phones and our ring signalers and amplified devices, we offer 4 years of warranty. With our mobile devices, we offer 2 years of warranty, and that's full support, full tech support. If you break your glass on the screen, we cover that. We just don't cover lost and stolen. We provide you with a case, so you get your device immediately already protected when it comes from FedEx or UPS. And then we have tech support and instructional videos to help our community. We're also working with I don't think they spoke at this session, an organization called Generation Tech. And they're a bunch of high school students who are so smart and brilliant. And we've collaborated with them to help our senior population learn. If they don't know how to use an iPad or an iPhone or a laptop, they do one-on-one training with them for free. So next slide. Just quickly, I Can Connect, that's our DeafBlind federal grant. It's for people who are both deaf or hard of hearing and blind or low vision. This is a little bit different. It's kind of open-ended when it comes to technology, whatever meets their needs, as long as it's telecommunications. So it could be phones, wireless devices, computers, software, specialized headsets, magnifiers, as long as it relates to telecommunications. The income guideline is the same. Again, one other extra component is we provide in-person assessments, equipment installation, and then also training. It can be as little as 1 or 2 sessions to as much as maybe 20 sessions, depending on the number of devices the person got and their learning curve, because every person is different. Next slide. So those are the examples I was telling you about. Also, Braille devices is one of them. Again, it's the list is huge, and it can be found at that website, icanconnect.org/equipment. But again, that's not even exact catalog. It's ever changing. Next slide. As I mentioned, we do the assessments, equipment, and training. Again, so you could take a look at this later, but it's very in-depth. I work with many of Shirley's consumers and probably many of your consumers. And I've been running it for close to 10 years now on the federal grant. That's it. Hope I didn't talk too fast.
Awesome, thank you. I'm gonna just get in the chat here and see if there are any questions. And JoAnne, I did have one question just with the pandemic. How has that shifted what you do or how you do it, or what trends have you seen?
So I have for the home phone and wireless program, the wireless program is still on an upward trend. The home phone is slowing down a bit just because most of those individuals go into a demonstration center to try a device first. Also the outreach is kind of tricky because I like to be in front of the consumers, and because we can't, it limits it a bit. So we rely on you guys to pass the word along, but yeah, I think that component is missing a bit there, and that's why it's slow. I wish it wasn't, because it's definitely needed. I think it's picking up a bit more lately though. So as the pandemic is kind of quieting a bit now. The DeafBlind program, we are able to do a lot of remote training and going into people's homes. We do temperature checks of the consumers as well as the trainers. Everything is clean professionally. So we take every precaution. None of our consumers or trainers have ever had COVID. If testing needs to be done, that can also be taken care of. But there is just some consumers on hold because they do have risk factors. Our oldest consumer is one of our newest and oldest consumers just turned 105, joined the program at 104, received her equipment just as she celebrated her birthday. And we were never actually able to meet with her, but we were able to do 100% remotely, working with the center. They had a tech person who is also one of the, a nurse there. And he worked with us remotely to get everything set up, and she was able to use it for her birthday. So I was thrilled about that.
Nice, thank you. And Jeannie, you're on mute.
I'm sorry. I had 2 questions. One, I too had an interest in learning a bit more about this program with your pairing are the high school students or college students with the older adults. And 2, it struck me that I'm not sure I was even aware that there was such a thing as a wireless phone in your home, that you don't need to have a phone connection. So I'd like to know a little bit more about that.
Sure. And I think somebody also asked about that organization. I'll put their information and website in the group. It's called Generation Tech. They are high school students, and we've trained them to how to work with deaf and hard of hearing individuals. And so they're cognizant of how to work with them when it comes to different communication tools. The wireless. So if you went to, say, Best Buy right now, you'd probably see most phones on the shelf have the letter blue, the B and it's blue. That means Bluetooth. Most even standard off-the-shelf phones are focusing on Bluetooth capability. So that just means that you take your cell phone and you take this Bluetooth, looks like a standard phone, and you pair it. So if you've ever paired anything with Bluetooth, whether it be your headset, you go to the Bluetooth settings on your phone. Of course, you have the phone plugged in, and it will search for that device. And then you just click it and you pair it. And you only have to do it once typically. Even if you walked away and went and you left somewhere and came back, it will reconnect. So what that means is when your cell phone rings, your home phone that's not plugged into any sort of phone line will also ring. And so all it is piggybacking over your cell phone service.
But you don't need a separate number for that wireless phone. It's coming through your cell phone line. I see. Isn't that it? Part of the reason why I had an interest in that Generation Tech group, the Aurora Commission for Seniors has applied to City Council for a name change. We're wanting to change our name to the Aurora Commission for Older Adults. And I think we're almost there. We also, as of this year, established what we're calling an intergenerational communications committee. And these folk are looking at working with Jan Hamburg and the Youth Commission, the Aurora Youth Commission, on connecting with seniors to maybe discuss or even enact intergenerational differences. So I'm really interested in that.
Yeah, they just give me chills. Actually, I just got chills even thinking about that, how just so sweet, so brilliant these kids are. It's specifically, I believe it's Cherry Creek High School, if I'm not mistaken, but they are looking to expand, getting students from other schools as well. But they have several founders, and those who I think have even graduated continue with the program. But it's a big group of students, and they're quite amazing.
So if I wanted to reach out to them, I would call Cherry Creek High School?
No, as I said, I'll post the website link. It's their own, they have their own organization. And I'll post it on there, and it has a phone number and contacts there too.
Great, thanks, JoAnne.
You're welcome.
Awesome, thank you. So there's one last question, and then we'll move on around the cost of the different pieces. Can you speak to that?
Okay, so first of all, if a person qualifies, there's no charge. We cover the cost of the equipment. The person's responsible for the service. So whether that means cell phone service, home phone service, or if they're getting a tablet, those are Wi-Fi only, meaning that they don't even have to have internet in their home, as long as they can find somewhere they can get free internet, whether it be the library, Starbucks, Walmart, wherever. They're able to use that device, because we do have many consumers who are homeless or very fixed income, and they just can't afford anything. And so we match them up with a tablet. In regards to general costs, if you just wanted to know if a person didn't qualify, I think the least expensive amplified phone is around $150. And then it just goes up from there. So that amplified phone with that tablet I just showed you, that's around $300. Again, it includes that tablet. But we also provide, if somebody gets a cordless phone, we provide them at least one additional handset, so they get two. If they need more than that for mobility reasons, they have many rooms in their house, we don't want them to run around and they're on a walker, we will provide a handset for each location. So again, it's very accommodating for the individual. Oh, and caption phones, by the way, if it was caption phones, technically, if you don't qualify for this program and you have internet, you can go directly to the company and get it for free. Landline are $85. You cannot get it for free. So that's $85. There's different companies that offer caption phones. But again, those are private entities. They do a great service, but us being a state agency, we want to make sure it's best fit. So we would like for them to come here first, get educated, and then they can make that decision where they want to go from there.
Awesome. Thank you so much. Thanks for the great information, a great program.
You're welcome. Thank you.
Yeah. All right. Shirley, you are up.
All right. Well, thank you, Jo. First, I want to just kind of clarify. I can't multitask, share my screen and talk at the same time. But I just want to clarify a couple of things. So I worked for a nonprofit for many years that worked with blind and visually impaired older adults. Unfortunately, in 2018, that nonprofit ran out of money and had to close. So when she was referencing my handing out those phones and doing that kind of stuff, that's when I was doing that. And then I'm also really excited to just mention to everybody that I'm co-chairing the Senior Circle with Joe now. So I'm really happy to be doing that. I've been coming to the Senior Circle for many, many, many years, and I've always found it of great value. I think it's a great group. So I'm just real happy to be working, helping Joe out.
Thanks for mentioning that, Shirley. I apologize. I didn't announce that. I didn't even realize we haven't had a Senior Circle meeting since you came on board. So
All
yes,
right.
very
No
excited to have Shirley as a co-chair. So thank you. Thank you.
No worries, no worries. Yeah, so are you able to see my screen? Okay, all right, good. I currently am now working with Audio Information Network of Colorado. I've been there for about a year and a half, I guess. Good time flies. Good transition for me. I've known Kim Ann forever, and I've been referring to Audio Information Network for a very long time. I'm a big supporter of what they do. And what they do is they bring print to life. Their mission is to provide news and information in an audio format for individuals who are blind, low vision, print disabled, or even those with some kind of physical limitation to reading. We believe our services empower individuals to be self-sufficient, connected to community, and continuously learning. We really want to make sure that everybody has access to news and information, regardless of what's going on with them physically or financially. So just to kind of give you a background of who we are, Audio Information Network was founded in 1990. They originally broadcast through KRMA Channel 6 radio, or television, I'm sorry. Rocky Mountain Public Broadcasting Service donated bandwidth and transmitters, so that's been continuous. That's how we transmit our programming that's over radio waves. We have 3 region-specific broadcasts. In the Northern Front Range area, that would be like the Denver metro area. We had Southern Colorado and then Grand Junction. And then we also added a broadcast station for Spanish speakers in 2014. We're a small local nonprofit. We're based out of Boulder. We have 8 staff members, not even all full-time, so we're pretty tiny in that regard. But we have over 150 volunteers, and that really does allow us to do what we do, because our volunteers are the ones who read and record our content in English and Spanish. We read roughly 120 Colorado newspapers. We read periodicals. There's service resources that we read, as well as a growing number of podcasts that are on demand, and much other programming. We read public service announcement type things on a very regular basis. So for example, during the census, we were reading census information for the Census Bureau. During the election, we were reading election information. During COVID, we've been reading information coming to us from Tri-County Health and other sources to keep people informed. So, all kinds of different programming and content to give people, a good option, depending on what their interests are. And our broadcasts run live 24 hours a day, 7 days a week. So we're always there. So, recognizing, particularly with older adults, that everyone has different situations, different comfort levels with technology and other things, different things going on. We have a lot of different ways that folks can access our programming. If an individual has access to internet, has access to the web, they can access us through our website. They can access us via their computer, their smartphone. We can provide them with a smart speaker, and they can access us that way. We also have pre-tuned Wi-Fi radios. So again, you need access to Wi-Fi, but that would allow you a very simple way to access us through a pre-tuned radio. Pardon me, I'm getting a dry throat here. And that's our Rocky Mountain PBS broadcast signal that is going out on the radio receiver. We have a toll-free telephone system, so they can call in and get broadcast, what's being broadcast currently, or other on-demand podcasts through that system. And then for folks that really either don't have any access to internet, don't want internet, whatever, we have our digital radio receivers that have an antenna that are extremely simple to set up and to use. Those, you just set them up and you turn them on and you're listening to what is being broadcast at that moment. So you don't have the options of on demand, but it's very simple to use for individuals that are just more comfortable with that. We serve all ages, we serve the whole state. We serve anyone with any kind of barrier to reading. So that could be, some kind of vision loss. That could be from a stroke or Parkinson's or arthritis. It could be some kind of learning disability or dyslexia, something like that. We don't really have a qualification process per se. All we want is to know that there's a need, so the client just needs to express a need to us and we're happy to serve them. And all of the programming, any equipment that we provide, it's all provided free of charge. So just, again, a really, really valuable service for individuals that have some kind of challenge to reading. Our process, our intake process per se, is extremely easy. They can just pick up the phone and call us and set up that way. They can go online and complete the application. We do want to make sure that there's some kind of conversation. Normally that would be with Matt at our office, just to make sure that they're truly aware of what their options are, the different ways that we can help them with their access, and make sure just that we're getting them the right equipment. Pre-COVID, we would set up an appointment for an in-home visit to set the equipment up and train the client on how to use the equipment. During COVID, Matt and our team has really done a fabulous job with workarounds, figuring out how to get folks the equipment and the training without going into the home. So we've made some really quality videos that people can access on YouTube that instructs them how to set things up. We've done some really good print material that helps them with setup. And Matt is just a wonderful resource. He's always there. He's so patient to help folks that are struggling in any way. As I said, we serve the whole state. It's sometimes a challenge to do that, as you can imagine. I guess that's kind of maybe a bright and shiny liner of COVID is being the outreach coordinator. I'm Zooming all over the state right now. So we're definitely expanding our outreach all over the state during COVID because I'm able to be there. We have a lot of partnerships. Again, I don't think we could do what we do without them. A lot of partnerships with technology, because sometimes the barrier for folks to get internet is a financial barrier. So we have partnerships to set up, hotspots and help people with access to the equipment. So with PCs for People, Livewire, Internet Essentials, we're able to help people get access to internet if that's a barrier. We've done a lot of infrastructure upgrades to help with the flow of accessing our programming, upgrading our servers, our computers, and our phone system so that when people call in to access that way, it's easier to use. We found out not too long ago that our time and temperature, so that's one of the services that we have, our time and temperature line had gone down, and we started getting all these phone calls from folks, what's going on with time and temperature? We can't get through. And it really made us wonder because we got a lot of phone calls. And we ended up realizing that we had about 150 to 200 calls a day to our time and temperature. So it really struck me that something that seems so simple to those of us who don't have barriers, clearly that's a huge service for folks that do. Because when it went down, they were quite upset. So we got that back up and running really quickly, but it really did open our eyes to, wow, that's a service that we would provide that we didn't even really think too much about. We just provided that service and then realized how very important it is. We do some other partnerships with particularly lower income senior living communities where we've really had some great successes rolling out smart speakers and tablets. Eaton is one of them. And, at Eaton, I'm sure that we've given out at least 40 smart speakers at Eaton. And, during the pandemic, one of the things that we did was we called all of our listeners just to touch base with them, to see how they were doing during the pandemic. We had resources, so we were able to offer them resources if they needed help with groceries or anything like that. But, in those conversations, it really hit home with us how valuable those smart speakers had become during the pandemic. People would talk about how it was like having a friend to talk to, how it made them feel less isolated. They were able to, not just access our programming, but they were listening to music and they were setting their medication reminders and they were calling their family using their smart speaker. It just really, really hit home how important that thing was to our listeners. As I said, we serve the whole state, so we have a lot of partnerships all over the state that help us spread the word, that help people get set up, in outlying areas where sometimes we can't quite go to. The Independent Center down in Colorado Springs is a huge partner of ours. There's some other service organizations out on the western slope and out on the eastern side of Colorado that really help us cover this huge territory that we have. And, I think one of the things that has always impressed me about Audio Information Network is how responsive they are to their listeners. They really focus on the fact that our content is listener driven. And what that means is we're constantly surveying our listener groups to make sure that the content that we're providing is what they want, what they need to hear. Sometimes there's a little newspaper in some little tiny town in Colorado that maybe somebody moved from there to Denver to be closer to family. And they want to hear that newspaper to know what's going on in their little tiny town. So, we've added a lot of content with that kind of feedback. But, just really making sure that we are adapting everything in our programming, our infrastructure to meet our listeners' needs. I think it's always important when you're dealing with a nonprofit to kind of know, where do you get your funding and how do you use it? Because I know when I donate to a nonprofit, that's one of the things I want to know. So, we are funded primarily by grants and donations. That's where we get our money. Obviously, clearly, the majority of that funding goes right back into our listeners. So back into our programs, our content, just back into providing our service. And then we have about 5% that goes to management, taking care of the office and our team. And then about 10% that goes back into fundraising. So a great part of what we get, goes right back to the people that we serve. So that's really the quick down and dirty about us. As I said, we're really easy to contact. I've got our phone number up there, my email. Does anybody have any questions for me? I see there's a question about the Independent Center. And yes, JoAnne, I can do that. I will, I'll have to look that up, but I can email you.
I have a
Okay.
second question for you too, though. I used to think, and I know I guess it was the Talking Books Library, but I used to think that you were also supported through the Telephone Users with Disabilities Fund, which is what we're supported through, and the Talking Books Library. So I'm wondering, do you
We do get a little bit of funding from them.
Okay,
A
because it's
little bit.
telecommunications, so I don't see why not. Yeah.
Right. Yeah. 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 Sorry, I forgot to mention that. Thank you.
No, I just thought.
That's okay. Yeah. Yeah.
No, I'm glad you do. I want you to.
Yeah. Yeah.
More money.
Yes, more money. Yeah, you know how it is. When you're a nonprofit, it's you know, it's always a challenge, but yeah, they really do a great job, I think, of managing their funding and managing their you know, use of funding.
Right.
Yeah.
Thanks,
All right.
Shirley. Any other questions?
Thanks so much, guys, for the opportunity to speak to you. I appreciate it.
Awesome. Great, thank you. All right, and Debbie, we have Debbie from the Colorado Talking Book Library.
Great, so thanks for having me. And Joe sent out digital documents for you. I decided I would skip the slides and send you the documents ahead of time. I'll just talk to you about that. You can either look at them as we go along or later, whatever your choice is. So you know you've got them and you don't have to like madly take notes.
And I think I just put the PDF of everything in the chat, so hopefully everyone can.
Oh, okay, great, thank you. So people can download it if they didn't get it. So like Audio Information Network of Colorado, we support any Coloradan who is print disabled, which includes vision, physical conditions that interfere with reading, learning, and reading disabilities. So all ages, and we are a statewide service. There is no fee for service to be members. People find out about the library through folks like yourself. So we, and friends and family, but we like to call you our ambassadors. And as you interact with your clients and people that you're working with directly, if you are aware of people who cannot read standard print, then you can let them know that there is this resource available. And we have an application that they would need to fill out, or you can fill out with them. And then you all would be eligible to certify the bottom. So the certification is simply a note to us that yes, indeed, you know these folks and they can't read standard print and need audio, braille, or large print books. So we are in the process of redoing our applications. So there is no need for, in the case of learning disabilities, a doctor to sign the application. That has now gone, finally. It took us 17 years of campaigning for this, but anyway, it's finally gone. Yes, so it's wonderful. So even if there's reading disabilities, you all would be able to certify the application. So the reason that it's 4 pages long is we have on page 3 subject codes. We are able to send books to patrons on a personalized cartridge. So they can, in their patron record, list authors, book titles that they want. They can list specific books. They can give us lists that they would like to listen to or read. But if there is not a list in their record, we can have subject codes so that the computer can pick books in those subject codes. So let's say I have a list of 20 books. It ends up on the first cartridge that gets sent to me. And I read them, and the cartridge gets checked in and is going to be redone for me, but there's no more books on my list. The computer will pick, let's say, a romance, a Western, a mystery, you know, and John Grisham, because that's what I have in my record. And so this enables patrons to have a steady stream of books to listen to. Now, we, I was looking for my player. Anyway, so there are two ways that you can get your books. You can get them through a download service called Bard. And if you have a smart device, and preferably a broadband connection or a cellular connection, you can get books downloaded to either phone. And the app is a Bard app, and you can download books directly to your app. And then when you're reading, I don't know if you can see this because of, there we go, a little bit. All right, so you can see that here's the buttons, and this is the play stop button, and that's the most important button. And it kind of, that screen mirrors what the player looks like. So you would be able to download your books 24/7. There's no wait. Nobody knows what you're reading. You don't have to deal with the post office, and it's quick and easy. And if we're moving more towards a Bard first model, where if you do have a smart device and you are using your apps, then we would prefer that they would choose that method. If they can't manage apps or they don't have a smart device, then we will send a playback machine that they can use. So, and then we will send physical cartridges for them to listen to the books on. They can also download web braille through the Bard app, and we are probably a year away from being able to provide a refreshable braille display for all of our braille readers who wants one to be able to read web braille, so that they don't have to have 17 volumes of a title in these giant books that have to go through the mail. So they can get it in hard copy, or I mean in a physical form, or they can get it in a digital form, which is great. They can get books. There is now, because we're personalizing all the cartridges, it's called duplication on demand. There is no wait for a book. So if we have 150 people who want the John Grisham book tomorrow, we can duplicate it for 150 people. So there's no waiting for books. So this is pretty awesome too. The mail containers that go out are generic. And so the letter carrier cannot see what book you're listening to, which is really nice. So that provides some privacy. On the mail card that's in the mail container, there is a list of the books that are on the cartridge. So if you have somebody in the household that can read it to you, you would have some idea that it's there, which is nice. So those service options are going to be showing up on page 2 of the new application. For the moment, we have we send books automatically based on your reading interests. Bible only. We do have patrons who only want to listen to the Bible, so we can accommodate that. We have 5 different versions of the Bible. We also have Spanish version of the Bible and children's version. So you can also exclude sex, violence, and language. We have 65% of our patrons do not want some combination of that. So we're able to exclude those books if they so choose. We also have a lot of Spanish books in the collection, but we have access to 130 other languages. And because of the Marrakesh Treaty, which provides the exchange of audiobooks across international boundaries for print disabilities, we are able to bring in many more titles in many more languages. So those collections are going to be growing over the next, permanently, but especially over the next 5 years as we work on that. So let's see. I have lots of material in hard copy. So if you want to hand out flyers like the flyers that you got in digital form, you could email the email address ctbl.info. It's on those documents that you got sent, so I won't repeat it. We can send that to you. We have bookmarks, large print bookmarks that we can send. We also have rack cards that we can send to you. And here is a picture of the player, and then you can see right over here the mail container, just a little corner of the mail container, but that just gives you a sense. So if you wanted some of those, we'd be happy to send you as many as you would like. And as often as you need. So, feel free, don't be bashful if you need materials to hand out. So let's see, I think that's all the key points. We have magazines that are available in audio, and there are about 50 titles that are in Braille and 50 titles that are in audio that NLS provides. Then there are 40 states that have recording studios in-house, and we record books of local interest by local authors. And in Colorado, we record Colorado history and Colorado outdoors. Oklahoma has Cowboys and Indians, I think, which may change their title. I don't know at some point. But there are a lot of states that are recording their local magazines that are available through BARD, so they would be available for us to duplicate if patrons wanted them. So there's lots of magazines to access that way. There's also descriptive video. So we have a DVD collection mostly. We have small Blu-ray collection, but that doesn't circulate very much because most everybody's using DVDs. So descriptive videos just take a regular movie and describe the action that's going on the screen that you need to understand the plot. And that is voiced between pauses in the dialogue. So we've got a lot of, not every movie has description. It's not like closed captioning, which is required at the federal level. Description is not required at the federal level. So it's up to the producers and the executive producers as to whether they would add that. But we do have descriptive video collection, which is great for people who want to watch with a combination of blind, low vision, you know, and sighted. They can watch together, which is nice. So very few of them are plug and play. So, you know, you do have to sort of do some magic in trying to get to where you can turn the description on. And that can be a challenge, but we do have those as well in the collection. So anyway, I think that's all the key points that you need. And if you have any questions, I'd be happy to answer. You can always email me directly. You've got my email, or send it through ctbl.info, and we'd be happy to answer your questions that way. One other thing is that we have organizational accounts. So you individuals could have an organizational account, which would then allow you to demonstrate BARD on your device for people that you're interacting with, or have a player so that you can demonstrate that if most of the people that you're working with you think would probably want a player instead of using a smart device. So anyway, all right, I'll stop there. Let's see if there are any questions.
Well, I just want to say this morning that I was in the Broomfield Service Network meeting, and the Spanish language development coordinator was in my little meeting box in Zoom, and we talked about AI in Colorado and the Colorado Talking Book Library, as you are both bilingual and you could help to support his community and other languages. And he got very nervous, and just, not all of my people that I serve get to be citizens yet, and some of them are waiting for their citizenship, and some of them are refugees, and I'm like, we are a very safe space, both of them are, and you don't have to worry about any of that. You just have to have a Colorado address, and they would really love to help support because they support all ages of people with disabilities. So he was thrilled to hear that, and I put your websites out to him and asked if I could help. So I just wanted to let you know that you went out across the Front Range this morning.
Thank you very much. We appreciate that.
Yeah, thanks, Barbara. And that's a good point. I mean, we do not have a citizenship requirement. We don't talk about that a lot, because there are folks in the state who think it should exist, but it's just residence. And so and the other thing is that we are part of a national network with the Library of Congress. So there's a library like this in every state. And if you are working with somebody who's moved into Colorado, who most likely would have had that, we can transfer their account from their state that they've moved from, or if they're moving to a different state to be closer to family or whatever, we can transfer their account to that state. So they don't have to lose their service just because they're moving. So.
I just want to also point out, several years ago, I changed the rules of this program for the state, where we used to have to require proof of residency, ID, what have you. And we took that out because of the burden that it was providing. Mm-hmm. So we also no longer have that, as long as they have a address. Mm-hmm. And there are other programs across the nation like this as well. We also are an owner state. So if they move, they can take it with them. So we don't require it back. So if Barbara, you work with that individual again, on your end, this is available to their constituency as well.
Awesome. Any other questions? Oh, great information, great resources. Well, thanks everyone for joining us. I really appreciate it. Our next meeting is in the summer. I didn't grab the date. I think it's in June or July, but you'll get an email from us soon to follow up from this meeting. And thank you to JoAnne, Shirley, and Debbi for sharing about the great resources and the work you do in the community. So thanks, everyone. Take care of yourselves, and we look forward to seeing you next time.